Hi everyone, so welcome to another lecture video in Principles of Surgery. Today we will be covering the chapter wounds for the second class, that is wound healing. Okay, before that 60% of viewers are not subscribing to this channel. If you like surgery, if you like my contents, please subscribe. Okay, दबा दो यार एक बार. So today we will discuss about wound healing. First one, the phases of wound healing. I have discussed in 4 phases. In some books you may find 5 phases. They are nothing but the elaboration of 3rd phase. Usually they will take proliferation as 3rd and wound contraction as 4th phase. Okay, but remember it like that: the hemostasis, inflammation, then proliferation and wound contraction. Last one is the remodeling. The first one, hemostasis. Suppose there is a traumatic wound or there is a wound which is caused by any sharp instrument or blunt instrument, whatever it is. So let us take open wound. Okay, so there is a open wound. First, what will happen? You will see bleeding. Okay, this is a blood vessel from where there is bleeding. Okay, so your body, what will do? First and foremost thing is hemostasis, control of hemorrhage, because if there is more hemorrhage, the animal may go into the hemorrhagic shock. Okay, so first one is hemostasis. In hemostasis, what will happen? There will be platelet coagulation. You know platelets. Okay, the platelets will come to the end point from where there is bleeding. Okay, you may know the clotting mechanism. I won't go to the details. So what will happen in coagulation? The fibrinogen or fibrinogen, whatever you pronounce, will be converted to fibrin. This fibrin will do the clotting. So there will be clot formations. Here and here there will be clot formation. And the cells present here, these cells, they will secrete some pro-inflammatory substances. Usually they are cytokines to initiate the inflammation. Also there will be some bacteria and virus. Usually any traumatic wound, if there is any traumatic wound, you will find some amount of organisms. It may not be in that level that will cause infection, but you will find some microorganisms. So then there will be inflammation. You see, this is day 0. Usually after 48 to 72 hour inflammation starts. There will be inflammation. You know the signs of inflammation, that is redness, swelling, pain and loss of function. You may be knowing in Reber Calor dollar and Functio Lesa. This is inflammation. So what will happen in inflammation? The vascular permeability will increase. You know there is pores in blood vessels. You may find pores. Through these pores, due to increased vascular permeability, the macrophages and the neutrophils will migrate to the tissue. The process is known as diapedesis. You might be knowing. So in this process they will enter the cells and they will clear out these infections or any foreign materials. Suppose there is some piece of catgut or sutures, they also need to be phagocytized, especially the catgut. Okay, remember the catgut causes more inflammation, but the vehicle and rest other tissue are digested by hydrolysis. You may refer to the suture class. So what will happen? They will clear out the infections. Next, due to the increased permeability, there may be some edema, very minor edema you may find, due to which there will be swelling. Okay, so this is the reason why while placing the sutures, don't make it too tight, because in the day 0 there is no inflammation. Okay, there is no swelling. If you make it tight, even if tight, when there is inflammation there will be swelling. The sutures will become more tight. Okay, that is why the suture should be placed just tight. Okay, just don't make it too tight or tight. After this inflammation stage, there comes the proliferation and wound contraction. This phase is the most important phase in case of wound healing. Proliferation, that is main thing is fibroplasia. There will be migration of the fibroblasts. These are fibroblasts, and they will secrete the extracellular matrix. The main component being the collagen, the elastin, the reticulin. Sorry, these are the main components of extracellular matrix. Okay, basically the collagen, mostly the high amount is collagen. What they will do, they will start filling up this gap. While filling up, the wound will start contract. Here you see the gap between two edges, it will reduce. You may find stretch marks. Okay, if the wound is a little bit large, you can appreciate the contraction marks. Like this, there will be contraction marks, the wound contraction. Okay, so there was hemostasis. So for new blood vessels, it is known as, for formation of new blood vessel, this is angiogenesis. Okay, formation of new blood vessels. So there will be formation of new blood vessels to this area, and remember this tissue, the fibroblasts, the extracellular matrix and the angiogenesis, they look pink or red in color, and this is also known as the granulation. Okay. Formation of granulation is a good sign, and remember, do not disturb the granulation tissue, there will be bleeding. Okay, because the capillaries are recently forming, if you disturb them, there will be bleeding, and this is also a very good sign that the wound is healing. Remember the granulating wound and the ulcerating wound. If you will find the pink red mass or pink red tissue, that is granulation tissue, which is basically which has the tendency to heal. The last one is remodeling. Remodeling is nothing but formation of the scar tissue, and also the re-epithelialization. Okay, there will be more wound contraction, the wound edges will come closer, and there will be formation of some scar tissue. Now the healing is complete, and remember the days. From day 0 there will be hemostasis, the first defensive mechanism. Then in the day 3 there will be starting of inflammation. Usually it is 2 to 3, 48 to 72 hours. There will be start of inflammation. In inflammation there will be increase in vascular permeability, there will be diapetesis, there will be migration of macrophages and neutrophils, which will clear out all the infections. Next, what will do, the body will do, there will be proliferation, there will be migration of the fibroblasts. Increase in the population of fibroblasts is known as fibroplasia. Plasia means increase. Next, they will secrete the extracellular matrix, mostly the collagen, reticulin and elastin. They will form the extracellular matrix, and the angiogenesis, that is creation of new or formation of new blood vessels, and all these tissue usually looks pink or red in color, which is basically the granulation tissue. After that, the wound will start contracting more and more, and finally there will be scar formation, which is remodeling. Okay. Sometimes there will be malunion or maybe some there will be difference in edges which will remodel, that is why the name remodeling. So this is all about the phases. Remember the 4 phases: hemostasis, inflammation, proliferation and wound contraction, and the remodeling. You see, in exam it may come as a short question, the short note. Okay, while writing short note, write this much only. you draw the figures and the points. No need to write. You see, there are some old concept teachers or basically the toppers who write too much. I have never written like more than 5 pages in any examination. I think except for LPT examination, in which I might have written more than 8 pages or something, but most of the examination I have written only 5 pages maximum. I usually prefer writing like this. It may be a tabular form or figuratively or any other form, but not like writing, oh, in this inflammation page there will be increase in vascular problem. Not like that. Those are time consuming and useless. The teachers who actually know you, or they know the things, by this they will know that student or the fellow knows something. Okay, do not write too much. Don't be a topper. I don't have any problem with the toppers, but see, learning, this is out of the box, but you should know, learning can be 2 types. Cognitive learning, next is emotional learning or emotive learning. In cognitive learning, it increases your IQ, the intelligence quotient. Next, the emotive learning, it increases your EQ, the emotional quotient. The cognitive learning comes from reading books, while the emotional learning comes from situations, life situations. Okay, so both of them are necessary in your life. The cognitive one, the emotional. Most of the toppers, not all toppers, most of the toppers are this type. They have very high IQ. Okay, they read so much, they write so much, everything, but they do not have the EQ, the emotional quotient. But the person who has EQ and does not have IQ is also useless. Okay, so you have to make a balance between the IQ and EQ. Okay, so you have to face your life situations, maybe heartbreak or anything, maybe your father have some problem or financial problems or any other problems. When you will deal with those situations, your EQ will develop, and EQ is also the smartness. How smart are you? Okay, so always try to make a balance between IQ and EQ. That is why I always tell whoever my batchmate or something, try to like this. This will hardly take half of a page, but all the informations are here. All the information regarding wound healing is here. Why to write like there will be increase in vascular permeability, there will be migration? No need. Simply this is enough. Okay. So always make a balance between the cognitive and emotional. You see, always in life, if you will come to the field, the person with more emotional quotient will go up, always up. You know, if there is a situation in which there is a background music from suppose in रेस मूवी का वो जरा जरा टच में बज रहा है, तो ये वाला तो पक्का टॉप कर लेगा ऊपर से, जबकि ये वाला नीचे से टॉप कर सकता है, क्या पता फेल ही हो जाए. So coming to the phases of wound healing, remember all the phases: the hemostasis, inflammation, the proliferation and wound contraction, and remodeling. Now we will go to the types of wound healing. Now coming to the types of wound healing. In books you will find 4 types of wound healing, but actually these 2 are actually types of the wound healing. These 2 you can say as the sub variant of these 2 or modification of these 2. First one is the first intention wound healing. Remember, the first intention wound healing is done when there is minimum bleeding and minimum granulation. healing occurs with minimum bleeding and minimum granulation. How this, the perfect example is sutured wound. Suppose there is a wound and you did suturing. Most of the time, remember, it should be a clean and fresh wound, because the ulcerating wound or having some infection, they are usually not sutured. What you did suturing. This is the wound and you did suturing. Okay, when you sutured the wound, there is perfect alignment of the wound edges. There is no gap between them. When there is no gap, first of all the bleeding will be controlled. Second, there is no gap, so there is no need of the fibroblasts or anything like that, or the migration of the extracellular matrix formation or like that, so that there will be it is not like that no granulation tissue will be formed, but there will be minimum, very minimum granular tissue. That is why this is known as the healing by primary union. Okay. When best example is when you suture the wound, perfectly suture the wound, you will find primary union. There will be minimum bleeding and minimum granulation. The opposite of this one, when the wound edges are separate. Suppose there is a dog bite case. In case of dog bite wound, you usually don't suture the wounds, okay, because there is heavy infection. If you will suture the wound, there will be pus formation or purulent discharge, there will be there. So what you will do, there will be wound edges which will be widely separated. Due to this wide separation, there will be thick granulation. You will find granulation tissue, very thick granulation tissue here in this type of healing. And next there will be wound contraction, etc., etc. You see in here you may not find the wound contraction. But the wound contraction is more substantial here. Remember these two, okay? First incision there will be minimum bleeding and minimum granulation, where in second intention you will find the thick granulation. And the difference are here the wound edges are perfectly aligned, while here the wound edges are widely separated. That is why there will be granulation tissue. These two are main. Usually these two are suberant. How? The third intention healing. Suppose imagine there is a wound. Okay, this is a wound. Suppose there is a formation of very thin granulation tissue, or this wound is in early phase of granulation tissue. If you leave it like this, it will heal under secondary intention, or you can say second intention. What you did at this point, you sutured the wound. Okay, you suture the wound. What will happen? The granulation will be minimized, but it won't be like first intention, rather than they gave it a new name, the third intention. It is third intention healing is that healing in which the wound otherwise which have been healed by the second intention, it heals by primary union due to suturing. That is why this is known as third intention. It is nothing but modification of second intention actually, or you can say this is a mixed type. Next, the mixed intention. What will happen? Suppose you have a wound which you have sutured, perfectly sutured. Suppose due to some activity or maybe some animal has disrupted some sutures. These four sutures the animal has disrupted, and there is some gap. Okay, here this part will heal by first intention, while this part will heal by second intention. This is mixed intention, first combination of first and second. Remember the difference between these two, the third intention and the mixed intention. In third intention, it should have been healed by second intention, but you are suturing so as to make it first intention. But here itself, it has two types intention present here. The first intention, the part where it is sutured, and in the sutured adhesive part there will be second intention. This is all about the wound types. There is another also, healing under scalp, you may find in Essentials of Veterinary Surgery by A. Venugopal. Healing under scalp. What is this? This is basically for abrasions. Suppose this is a skin. Okay. You remember the abrasion? Only the part of dermis, epidermis or dermis is lost, like this. What will happen? There will be skin bleeding. So there will be a scab formation. You might have noticed while playing during childhood, okay, when playing you may fall down and you will have abrasion, and after 1 or 2 days you will find a scab. Under this scab there will be healing. That is why sometimes the scabs usually fall off naturally. So your parents might have told you, don't disturb this scab. There will be healing process going on under this scab. That is known as healing under scab. It is basically for abrasion. Usually this is not a type of wound healing, but you can count it as type of wound healing. So wound healing comes as a short note question. In your examination it may come as short note questions, or sometimes there will be objective questions like if a sutured wound is partially disrupted, then in which type of healing will be there. You may write mixed intention, like this. There will be some objective type questions. So this is all about the wound healing. Okay. So next class we will go for wound treatments. That is also a very important class. We will try to cover the traditional treatments as well as the modern treatments. Thank you very much. We will meet in next class. Bye bye. Stay safe.